interior part, I would like to know, during our discussions, we have, you have shared some of the things like which you'll be seeing as new materials, new products, something new we are going to see in the healthcare space, in the interiors, for real good reason.
Hello everyone, thanks for having me over. In terms of what you're saying with regards to products, I'd like to touch two things really, because when we're talking about engineering and construction, there's one, the constructing part of it, and then there is the asset intelligence part of it. Dr. Lal and Harish both have said that technology is getting embedded into every parts of the hospital. So first, with regards to what you've asked, Vertika, in terms of materials, and this is something that Ajay has covered as well. Even when we're building fast hospitals, it's dry, hybrid, and modular technology that's there. So there is no single answer. It's an orchestration of several technologies. What we find while we are doing a lot of work is that most of these technologies become very vendor-driven, and one aspect of it gets exaggerated more than the others. So, for example, when we did the hospital at Varanasi, we had steel structures. Steel structures have been around for the longest time. They are the fastest to build, and social distancing. 600,000 square feet built by 60 people only in terms of the steel structure. Dry walls, adhesive-based flooring. So there's a lot of dry, hybrid, and modular technology out there. It's about orchestrating this technology to deliver an architect's design intent and a promoter's operational intent. So there's no cookie cutter model that you can say, okay, that's it, every time it's going to happen like this, and a new hospital is going to get built. So that's from the perspective of, sort of constructing hospital and how dry, hybrid, and modular technology can be accentuated. Second is with asset intelligence. Technology is coming into the hospitals, but we need a common data lake of these inputs coming in. If you take the example of Uber can give today the best urban planning advice is because they're tracking how people are moving within the city. One of the key intelligences that we don't have in hospitals is, do we have the intelligence of what our asset flow is, what our asset density is, how can we reduce energy? In terms of intelligent building management systems, in terms of healthcare specific technology, all these sources are giving many data points. Again, here as well, it becomes vendor specific when you executed each technology within silos versus thinking how asset intelligence can give the feeder from one technology to the other technology and get a better understanding of assets are getting used. The disconnect between design and asset use, like Dr. Lal pointed out, is huge because we designed it and then we don't go and see how it is actually getting used, the facility. It's not also about just the handover. Remote intelligence is very easy to implement in today's days. So designers who build hospitals can actually get intelligence from operational hospitals at various aspects and start advising on how things can be better. So sort of to close this, I'd say if you know what's going on, then we can improve it. It cannot be a case of my guess against your guess. It's a data industry, let's use it.
Wonderful, Akhil, and the energy is visible actually. How are the futuristic hospitals going to be? What, if you can tell us a little bit about the world's, some of the best facilities that I think you have also worked for one or two of them. So if you could just tell about the uniqueness of those facilities and how India can learn from them.
I'd like to keep this brief because I've covered a little bit on asset intelligence already. But it's a case of remote intelligence, right? You don't need people who are operating assets physically in the asset to get the intelligence and guide the on-ground people. It's about also covering multitudes of aspects of it. So while you've got the equipment that can be smart, you've got sort of the systems that can be smart. It's also about getting feedback loops. A lot of the developed nations have spent tremendous amount of R&D money in terms of making sure that the occupants of the assets have an opportunity to give a feedback back to the asset, whether it's via app or whether it's pressing some buttons. To sort of close this point on remote intelligence simply, because I can keep going on forever, but intelligent building management systems have been around for a long time. They've become a checkbox within assets now. All the hospital assets will say, yes, we have intelligent building management systems. But are we monitoring every circuit there? Can we optimize energy every month on month or year on year by taking actions that are suitable for it? Similarly, predictive maintenance, that's a large thing that good assets do. They see the trends of every system working at an hourly basis to identify an anomaly, saying that before something breaks down, let's have it rectified.
Okay.
So, in terms of what the future of assets or healthcare is going to be, it's going to be a feedback loop of all the systems and the people and the physical assets itself coming back to a remote intelligence for making it more efficient and changing with the needs, because the needs are not going to remain consistent. Today, COVID has changed it.
What is the status of India in terms of healthcare systems, facilities, and infrastructure? Where are we standing?
Healthcare infrastructure in India is a mixed bag. On one end, we are providing basic healthcare to the poor section of the society. And on the other end, we have large hospital chains like Medantas, the Fortis, and etc., who are JCI compliant. So there is a complete range of facilities that are available. In terms of facilities, we are lacking in terms of hospital beds. We are around 1 bed per 1,000 population. We aim to be by 2050 to reach to about 2 beds per 1,000 population, whereas the WHO talks about at least 3 beds per 1,000 population. So definitely we are lacking in that aspect, but we do have all kinds of facilities available, and the thing is being improved by the government in terms of setting up a lot of new hospital, new AIMS projects are coming up. I think 22 of them. All district hospitals are being upgraded to medical colleges. This will not only increase the bed capacity, but also increase the number of doctors that are going to be available in the country. Things are happening, but yes, we are lacking in terms of in actual number of beds. But on the other end, we have these JCI compliant hospitals which have the best medical care being provided to people not only in India but people who come here for medical tourism.
Right.
About the kind of infrastructure that we're talking about, I think we are in a right direction. No doubt, we are way behind today. But then, as you know, the government is really pushing things forward in terms of having more medical colleges and more hospitals there and there. And it's very established fact that all these district headquarters hospitals, they are being turned into medical colleges. And this will definitely enhance our human resource of the healthcare infrastructure, which is highly deficient today.
I'll take that. I personally feel today in India, we are designing healthcare facilities to level to any global, actually. To be very frank, I have done hospitals in US, Middle East, Africa, India, at least 10 countries. Today we are at par. The problem is not the design or the execution, it's actually the financial modeling of that, who it supports.
So I would like to add to what Ajay said. I think, gone are the days, I think Indian healthcare system was looked down. I firmly believe we are far ahead in terms of our infra capability and science which we bring onto the table. And in terms of that, I think I'm very proud of the fact that the industry is leading the flag, whereas private healthcare contributes almost 85% of the services delivered as far as healthcare is concerned in India. And that's also have to go by saying that, the world-class infrastructure are now in tier 3 cities also. We are no more dependent on, world-class so-called, the creme de la creme only can access a
wonderful. Now go to architect Varun Sharma, and I would like to know, he's from All India Institute of Medical Sciences. I would like to know about the same question about how are we at in what level are we in terms of global best healthcare facilities?
About AIMS, I can tell they have very good key performance indicators in terms of patient safety, because here the operational processes are streamlined. There is full infection control, and patient safety is also there. There are minimum number of falls, and every error is being recorded. So I can talk about our institute. We are actually one of the best hospitals in northern India. And
I would want to comment that I come from a hospital which is a JCI hospital, and we do procedures which are by far the most high quality and the best in the country, if not the world. And I feel in terms of people and processes, we've done a fantastic job as far as the South Asian region is concerned. The challenge that usually comes to tertiary or quaternary care hospitals is because the infra is already done. So, I'll give you an example. In today's situation, when a patient comes to the hospital, the patient lands to a flu clinic which is near the emergency, and for some reason, we never kind of, thought ahead in time to have a proper large holding area for patients. So, we need to take a step back and reprogram and understand that it is now the time to start investing in preventive health. It is now the time to start investing in pandemic health, pandemic management, disaster management.
Everyone, we all as architects and designers of the healthcare sector, they all are focusing on the infrastructure. They are focusing on patient safety. But till now, nobody actually thinks about the healthcare worker safety. That is one area which should be incorporated while designing any hospital. Right now, it's a compulsion that we people are now moving towards.
Thank you so much. Akhil, you wanted to add something?
Just a quick point when we're talking about modularization of spaces. Airlock lobbies is something that people don't speak about as much. Airlock lobbies have been integral to critical areas. Now these airlock lobbies need to move out of critical areas to become junctions within a healthcare facility. Because a great amount of what we are talking about, air conditioning and ventilation flexibility, can be brought by dividing the spaces with these airlock lobbies. That's it. Simple point.
Thank you for adding that on. Please continue.
The principle of smart cities is about developing your neighborhoods, right? And typically, what Dr. Lal is talking about preventive care, it comes outside of the asset class, which is healthcare. So, as a smart city or a node within a smart city, a hospital can influence all non-healthcare assets in terms of how they can improve upon preventive care in terms of testing, or just basic dissipation of information. So that's it, a little point from our end.
Definitely. What is your one-liner message? Which area they should really, should not compromise on? One-liner message, and then we close. Yes.
So if you ask me for a one-liner in today's situation, I think
I know it's difficult.
The only thing I can think of is capacity building.
Capacity building, wonderful. Yes.
I'd like to add to that capacity building with, as Varun very rightly said, modular, flexible design so that things are easily adaptable to various kind of situations as they happen. And the time to invest is now, because for healthcare investors, because this is it has shown us that we are really lacking in capacity, as Dr. Lal Relly said. This is a time to invest, and that is what is going to be required.
Yes.
So I think it's easier building the infrastructure, but very difficult to get the right manpower to handle that. Still, there are many setups which are lying where there are not sufficient manpower. So that is one area which the government should actually focus along with building up the infrastructure and gearing up for the increased number of capacity.
Sure.
My one-liner would be, actually, we should just drop what we have learned. Just use common sense right now. I think common sense will help us. I truly believe common sense will be the killer now. I think that is what it is.
Very rightly said, Ajay.
So next.
I would rather say that, the time to relook at, I think I would pick the madam's point, which is just now mentioned. I think infra we are creating, I think this high time we should look at the manpower very crucially at this stage, as far as this pandemic has brought into light. Nursing is something which we should, as India, should open eyes to something like nursing very soon. It's going to be a disaster that you will end up with no nursing in this hospital, in this industry itself, because there's so much of drain happening. Nobody is adopting nursing as a profession. I think high time we should start focusing on nursing big time. That is a talent pool which is big gap. It is silently coming up in the industry. we might end up creating beds, but there won't be anybody to service it. So this big time we should start focusing on nursing, which is a very, very crucial area.
Wonderful, wonderful. Thank you so much. And definitely moving to Akhil and Architect Varun Sharma.
I mean, 2 words in those sense: speed of construction. I mean, we built a 6 lakh square feet hospital in 12 months, and it can only become faster than this. So if you want to increase capacity, it's going to be frugal innovation to get speed of construction.